My name is Dr. Kendall Nuttles, and I'm an associate professor in the Department of Cancer Biology here at Scripps, Florida. One of the things that motivated me to switch my research in graduate school was having a family member, my stepmother, who had breast and ovarian cancer, and she actually was one of the first people diagnosed with one of the predisposition genes, which is how you end up with breast and ovarian cancer. We could do, basic research anywhere, but the ability to make something that could actually affect patients requires a special set of tools and expertise that we have here at Scripps, Florida. My research focuses on cancer, mostly breast, prostate, and ovarian cancer.
When I moved into the community, my sister had just recently passed away from breast cancer, so I was ready to dive in. And when I first met Kendall Nuttles, he turned on his computer and started explaining to me all the things he was doing. He was so excited about it that I knew it was a good thing.
One of the things we've worked on for a number of years is to try to develop improved hormonal therapies. So there's already something FDA approved. It's being taken by millions of breast cancer patients right now that can prevent breast cancer. But it's not used for this purpose because of the side effects. And this is one of the things we've been trying to do, is to understand what causes these effects so that we can develop better preventative agents. We have been effective in developing a compound that is useful for preventing or treatment of endometriosis, however. And so we think this is something that we can also apply to breast cancer. We're now starting to also focus on immune therapies, and these have proven to be really one of the biggest breakthroughs in cancer in years. So they have these therapies that make your immune system retrained to effectively eat the cancer the same way it would a bacteria or a virus. And in the clinical trials that are coming out, these therapies are actually curing people with things like late-stage melanoma that would have only a few months to live. And so we're trying to develop similar types of therapies that would apply to other cancers, such as breast, ovarian, and prostate cancer. One of the things about these immune therapy drugs is that they are often antibody-based therapies. And we have one of the greatest antibody engineers in our department to help us make these new types of therapies. So we think that we might be able to get something just in a few short years that could go into the clinic.
Once you've lost a loved one, you just want to keep anybody else from having to go through that. So the only way to figure it all out, in my opinion, is through research.